Okay, perfect. Hi, everyone. Thanks for joining. My name is Lakshmi Valliyappan. I'm originally from Atlanta. I'm currently studying in Baltimore. I am a third year college student at Hopkins, and it is my pleasure to moderate today's webinar. And I'm going to go ahead and jump right in to introducing our two speakers for the day. So first, we're going to have Dr. Siva Venkatachalam. He's going to speak on dental hygiene, focusing on preventative strategies and habits that we can all incorporate to support our long-term oral health. A little bit of a bio about Dr. Venkatachalam. He's been practicing dentistry for the past 4 years. He grew up in Columbus, Georgia, and earned his bachelor's degree from the University of Georgia before pursuing dentistry and receiving his Doctor of Dental Medicine degree from the University of Florida. So after practicing in Florida for a couple years, he relocated to Atlanta, where he continues to provide patient-centered dental care. Throughout his training, Dr. Venkatachalam maintained a strong commitment to both service and education, so we're so grateful to have him as a panelist today. During dental school, he participated in a mission trip to Jamaica where he provided free dental care to underserved populations. He remains very actively involved in our community by volunteering at local events and emphasizes prevention and education as the foundation of oral health. He is an active member of the American Dental Association and the Academy of General Dentistry, as well as the Georgia Dental Association. His dad said that he's the first dentist in the family and is widely regarded as the trusted dental resource among his relatives. And outside of his professional work, Dr. Venkatachalam enjoys spending time with family and friends, running and playing recreational tennis. So give it up for him. I know that you guys can't, but and then later in today's session, we're going to hear from Dr. Sindhu Kannappan. Dr. Kannappan is currently a pediatric dental resident at the Cohen Children's Medical Center in New York. She's originally from Marietta, Georgia, and earned her undergrad degree in biomedical engineering from Georgia Tech before graduating from the University of Michigan School of Dentistry earlier this year. Dr. Kannappan is drawn to dentistry, she said, for its unique integration of science, precision, and patient interaction. She's passionate specifically about pediatric dentistry, where she works closely with children and families to reduce any anxieties surrounding oral hygiene and establish healthy habits early in life. So she finds that the dynamic nature of caring for children makes the specialty both challenging and rewarding. In addition to her professional accomplishments, she is a classically trained Bharatanatyam dancer and completed her Arangetram. She also enjoys creating artwork and spending time with friends and family in her free time. Dr. Kannappan's presentation will focus more specifically on pediatric dentistry with an emphasis on age-appropriate care and prevention earlier on to promote lifelong oral health. So please join me in welcoming them both, and we'll have our first speaker give their presentation.
Thank you. Thank you, Lakshmi, for that great intro. I really appreciate everyone logging in today. I know it's a Saturday before Christmas, coming in and spending time. I'm really excited to share some dental knowledge to y'all. And if you have any questions, we will have a question and answer session at the end of the webinar. But feel free to chat, and then Lakshmi can moderate and let us know if we have any other issues. Thank you. Okay, so this is just a highlight of what we're going to be talking about today. The first part will be more of dental education, kind of like, what's the basic tooth, like what's oral health, how it is important to you. And then I'll kind of brush over some oral hygiene tips, like brushing and flossing, the right ways to do this stuff, give you some models for that. And then also talk a little bit about dental treatment, different types of dental restorations, like fillings, crowns, and then what to do in a dental emergency and some home care advice about that. And then Sindhu will take over at the end and talk a little bit about pediatric dentistry and give you some tips for the kids and to learn more about that. And then at the end, of course, we have a Q&A session. Okay, so dental education, as you all may know, the importance of oral health. It helps prevent tooth decay and gum disease, and of course helps improve your smile and quality of life. But there's also a lot of important things with oral health. It's not just to help keep your teeth white, but there's a lot of connections to the overall general health well-being. For instance, patients that are diabetic have a high risk of having dental cavities. High glucose levels can increase the risk of tooth decay. And then any patients with heart disease also has an increase of having periodontal disease as well, which means your tooth has a lot of bone loss and your teeth get loose because you have, a higher risk of heart disease. So patients that are diabetic and have heart disease should go see a dentist and they're more frequently because of their systemic conditions. I'm going to go ahead and start a poll on this webinar just to see when's the last time y'all visited a dentist within the last 6 months, from 6 months to a year, or over 2 years. And then Lakshmi can kind of discuss the results and we can kind of go over that during the Q&A session. Yes, perfect. And then you can see in this infographic here, the one important thing that I like to show most patients is like 78% of her teeth kind of get cavities before the age of 18. So it's very important for you to see a dentist at an early age to help prevent this from becoming worse or problems. Okay, now the structure of a tooth. Okay, so the most important part of the tooth is the enamel. So you can see here, can you see this in the model? Yeah. So the white part of the tooth is called the enamel. It's the strongest layer of the tooth. It's, well, in fact, the strongest mineral in our body. And then the yellow part of the tooth is the dentin, and that's where cavities start forming. It's softer and mushier. So once the cavity forms, once the bacteria gets into the enamel and then it gets into the dentin, that's when a dentist needs to do a filling. So filling is where we drill a hole into the tooth, get into the dentin, and clear it out and put a filling material in there. So that's the yellow layer of the tooth. And then the pulp is the bloodstream, the nerve supply of the tooth. So once something hits the nerve supply, that's when you start feeling toothaches and tooth pain and stuff like that. So we want to prevent that from happening. So we want to get stuff in the enamel. If not, the dentin is where the filling happens. So there's three layers to your tooth. The enamel is the white layer, the strongest part of your tooth. Then the dentin is the yellow layer under the enamel, and then the pulp is the red blood supply for the tooth. Let's see it here. And then the numbering system, I guess it's important. We have 32 teeth in our body. And this is the adult permanent detention. You can see this is a little dentition I have here. So we start from the upper right side. It goes from 1 to 17 to 16. And then we go from the bottom here from 17 through 32. And then the molars, the last third molars are your wisdom teeth. Usually those are removed. So technically we only have 28 teeth, but in general, 32 teeth are erupted. So it starts from the upper right side, goes all the way to the upper left, and then from the lower left all the way to the lower right. And the molars and the premolars are usually in the back of your teeth, and then the canines and the incisors are in the front. See here. Okay, so what is gum disease? So, kind of talk to you a little bit about a cavity and how it's formed. Another way of getting dental problems is through gum disease. So, gum disease is the pink layer around the tooth, right? So, our tooth is connected to the bone, and then we have gum tissue around the teeth. And you can see here, this is a healthy tooth and gums. And then once you have gingivitis, which is the disease of the gum tissue is inflamed a lot. And then periodontitis is when we get bone loss around the teeth. And you can see here, that's where there's a lot of bone loss. So even though your teeth can be healthy and there's no cavities, you can also get periodontal disease where the gum tissue and the bones around the teeth are not supporting the teeth and they become looser and they start falling out. So it's very important to clean and make sure you go see your dentist to make sure that's taken care of because they do that gum check to make sure you don't have any periodontal disease. And that can lead to teeth being loose. So gingivitis is more of a reversible where it's just bleeding gums, but periodontal disease is more intense when the teeth are getting loose because there's no bone to hold them. So imagine like if a tooth is like, your house, you want the foundation to be right. If the foundation is not right, then the house will crumble. So it's the same thing kind of with the gum tissue and teeth. Another important thing is oral cancer. Oral cancer is very common. It's one of the most common cancers above the head and neck. It's important to get early detection. So it affects the mouth, lips, gums, teeth, and tongue. Typically starts as small ulcers that doesn't go away and then they become red and white patches. The tongue is the most common area where we see oral cancer, especially in the back of your tongue. So it's one of those things to make sure you're brushing your tongue, every day, kind of just to make sure no bacteria doesn't get stuck in there. Risk factors for oral cancer, a very common one is tobacco use. Chewing tobacco is really bad and can cause cancer. Smoking, drinking alcohol, pan chewing. I know a lot of Indians chew pan. That's basically chewing tobacco in your mouth. So that can also cause oral cancer. And then long-term sun exposure as well. That's where you can usually get carcinomas in your lip that can affect your teeth as well. So it's important to see a dentist because every patient we see, we do an oral cancer screening as well. And these are just areas that we look at to check if you have any oral cancer screening. But if you ever see like a bump in your lip or in your tongue that doesn't go away in a while, it's something important. So definitely go see your dentist. Okay, so now the second part of the presentation, I'm going to talk a little bit about oral hygiene tips. So brushing and flossing, as you all may know, brushing always twice daily, morning and night. One important thing is brushing at night is the most important. So why is it more important to brush at night than in the morning? Because when you brush at night, after we close our mouth when we're sleeping. So that's when bacteria can get into your mouth and start forming cavities and stuff like that. So it's always important before you go to bed to brush at night. Of course, brush in the morning as well, but brushing at night is very, very important. And then use a soft bristle brush. So whenever you're looking for a toothbrush, make sure it has soft in it. Those are always important because if you get brushes that are hard or coarse, they can brush away healthy enamel or healthy tooth structure. And then brush at a 45-degree angle. So I can kind of show you here. See this here? So just kind of brush from the top to from the bottom to the top like that, okay, for every tooth. So don't brush left to right like this. You kind of want to brush each tooth from the 45-degree angle, kind of like that, okay? Okay, can you see this a little better now? Yeah. So brushing from the 45-degree angle, so kind of like that from each tooth instead of brushing straight, kind of like this. And you want to spend 2 minutes brushing. And then it's also very important to replace your brush every 3 months. Okay. And then flossing. So flossing is,
Can you use the side by side photo?
yeah,
So they can see your video.
1 second.
I can go on the file for you guys.
Yeah. Yeah, do you want to hold it? Yeah, hold on. There you go. You can see that. Now for flossing, okay? So flossing is just like a string that you go in between your teeth. And I want you to know it's important not to go up and down like this. You want to go in a C shape to kind of get to under the near the gum tissue of the tooth, and then you floss out kind of like that. So it's very important to go with the C shape and curve it out between your teeth. So kind of like this. Oh, sorry, that came out. But that's the most important thing is to go in a C shape and floss in between every teeth. Okay? Yeah. And flossing is very important because it's the most common area for cavities to form in between teeth. It cleans areas that the brush can't reach. Another pro tip I've learned is always add a little bit of toothpaste to your floss before you start flossing. Just kind of glaze it with the toothpaste so the fluoride in that toothpaste can go in between your teeth. And then always floss before you brush for best results. You can floss after as well, but flossing before is better only because you can kind of floss in between the contact areas, remove all that plaque, and then you can brush away that tartar and stuff. If you floss after, you might not be able to brush away most of that stuff. So it's better to sometimes floss before you brush, I think. And then a common question is, what's the difference between electric and manual toothbrush? Both are great. They both can achieve the same thing. An electric brush just helps achieve a good cleaning in a quicker manner. And a manual brush works great, but you just have to use it properly. Electric brushes more effective in plaque reduction. They have built-in timers. They even have like pressure sensors. So if you're brushing too hard, it'll tell you to, hey, you need to stop brushing too hard. It tells you also for 2 minutes, it gives you a timing as well. So it's easy for those with that are in braces, arthritis for older people, electric toothbrush. Manual brush is great. It's more affordable, of course. Relies heavily on user technique. Like I said, always go in a 45-degree angle and brush every tooth from the bottom to the top. Water flossers. So if you're having trouble flossing in the back and it's getting really hard there, sometimes even I have trouble. A water flosser is sometimes better. They're more like an automatic flossing machine. It's an oral irrigator that cleans between your teeth. Great for plaque removal. Helpful if you have implants, crowns, and bridges. Helps go in underneath the bridge and clean really well there. Also used for patients that are in ortho or has braces, can really go in between your teeth and help floss there. So a quick rule I always recommend my patients when I see them is it's called a 2-2 rule. Brush 2 times a day for 2 minutes each and visit a dentist twice a year for cleanings, and that usually will help, get you stable overall oral health. Just, 2 minutes a day, so it's 4 minutes a day if you're brushing, definitely helps prevent a lot of cavities and stuff like that. And now a little bit about diet and how it affects oral health. Obviously, sugary and acidic food are not good. Try to limit the amount of sugar intake you have for 3 times a day. And if you're eating sweets, always eat sweets with meals instead of separately. So if you're eating lunch or something, have your lunch and then eat your dessert right away instead of waiting and eating afterwards. That can cause, that's another area for bacteria to grow in another time when you're just eating the sweet. So if you're eating sweets, try to eat it with the meals instead of separately. Eating calcium-rich food is great. So like stuff like milk, cheese, yogurt, any dairy products are really good for your teeth. Fruits and vegetables, of course, help stimulate saliva. Saliva is also very important. The more saliva you have in your mouth, the harder it is for bacteria to get in. So the drier your mouth is, the worse it is. So the saliva is good. So protein food as well, like eggs, fish, stuff like that, help repair gum tissue. And then for drinking stuff, water is always the best option. Best drink for teeth and gums, helps prevent dry mouth, like I was talking about earlier. Unsweetened teas and herbal teas are great. Soft drinks, juices, and sodas, not so good, can cause cavities. So if you are drinking a soft drink or a soda, try to drink it at one sitting. Don't sip on it. The more you sip on it, that causes bacteria to come in at different times. So if you are having a Coke or something, just drink it in one setting, then sipping on it. Coffee, of course, everybody drinks coffee. It stains your teeth. So if you are drinking coffee, try not to drink it too hot and rinse with water right after, or use a straw. Straw does help prevent the stains from happening. And then there's types of toothpaste. I always recommend a pro tip is to, whenever you're looking for a toothpaste, there's so many toothpastes out there. Make sure it's ADA recommended. What is ADA? It's American Dental Association. You want some fluoride in the toothpaste. So any toothpaste that says ADA recommended and has fluoride is always good. Helps strengthen your enamel and is used for everyday use. There's always this hot topic about fluoride and not no fluoride. I always recommend a little bit of fluoride, especially because sometimes the water that we're using doesn't have fluoride anymore. So it's always good to have a little bit of fluoride in your mouth. And then when you're putting your toothpaste, don't put too much. You just need a little pea drop in your toothbrush. So that's an important tip. You don't have to go all out with the toothpaste. There's also whitening toothpaste. That does not change your tooth color. That just helps strengthen your enamel. So just because you have whitening toothpaste doesn't mean your teeth are going to get whiter. And then toothpaste for sensitive teeth is important. So if you're having some sensitive gum tissue, stuff like that, I recommend Sensodyne. It's a brand you can get over the counter. And you can apply that Sensodyne in that area overnight and does help, desensitize that area. So it's important to get, if you have sensitive teeth or sensitive gums, you can use Sensodyne. Alternate that with your normal toothpaste. A natural toothpaste is something I would avoid. So anything like charcoal, baking soda, heme, they don't have fluoride. They're aggressive to your teeth. So definitely, the charcoal toothpaste is becoming more and more popular. It's the black toothpaste. Definitely highly recommend not buying that because it's just going to cause more aggressive tartar and enamel buildup kind of thing. And then don't rinse after you're brushing your teeth, just spit out. So you want to keep the toothpaste in your mouth as long as you can. So after you brush, a lot of people, rinse their mouth and make sure everything is clean. Sometimes it's better to just spit the toothpaste out and leave some of it overnight because the fluoride in the toothpaste will help, when you're sleeping and stuff. So you just kind of rinse it. Don't rinse, just keep the toothpaste in your mouth overnight. Sometimes that helps as well. And then mouth rinse is important to use after brushing or flossing. It's not an alternate for brushing or flossing. It's just to help prevent bad breath. Always recommend rinsing 30 to 60 seconds after. Avoid any mouth rinse with alcohol in it. So the pink or purple Listerine is good. Actin, I have some examples here. Pronamel is good. Just make sure the mouth rinse doesn't have alcohol. If it does have alcohol in it, it's causing worse problems than that harm. Okay, the last section here is dental treatment and emergencies. I talked to you a little bit about each dental treatment. So fillings, kind of example here. So basically, when it goes into the dentin, what we do is we drill it and make a little hole, remove the cavity, and we place a filling material to help remineralize the tooth. Then there's crowns and bridges. So I can show you an example. So this is a crown, which is like a cap on a tooth. So a crown is recommended when the tooth is damaged or weakened, or you have a crack, or the decay is really massive. And that's when we remove the decay, prep the tooth, kind of like this, and then we place a porcelain cap on a tooth. It's similar to just you brush and floss normally, but it's another important step. It's like it's bigger than a filling, so then you need a crown. And then a bridge. Example here basically replaces a tooth. So if you're missing a tooth, you can get a bridge where we crown the tooth in front, like right here. We crown the tooth in the back, and then we're replacing the tooth that's missing. So it's like three crowns like fused together. So this is a bridge. And then now this is more the root canal treatment and implants. So a root canal basically is like a really deep filling where we kind of go into the nerve of the tooth. So you can see here that's the pulpal layer. So if a filling reaches the nerve of the tooth, we have to go into the nerve, clean out that infection. And basically the nerve in that tooth is dead. And then after we do the root canal, it's important to get a crown, which is like a cap on a tooth. So once a tooth needs a root canal, it's basically at its last step. So we do remove the nerve, clear out the infection, and then seal the tooth to prevent any further infections. And then implants. So implants pretty much is like a titanium rod in your tooth. Okay, so that's gonna act like the root. So when you lost a tooth and you want to replace it, an implant acts like the placeholder. So you basically have a titanium rod. Kind of, I don't know if you can see it. Yeah. So it's like the rod right here. Yeah. So you can see that's like the rod. So that's like the root of the tooth, and then you place a crown kind of like right on top of it. Okay. So that's how you replace the tooth, which is an implant. And then what do you do if you have a dental emergency? So say you're playing tennis or soccer and something happens and you knock out your permanent tooth. If you can, try to keep the tooth that you knocked out in a bag of milk or saliva and try to see your dentist as soon as possible. There is a possibility that they could, put the tooth back in and let the gum tissue grow over it. But you have to go within like a certain time limit. So that's a possibility. But if that happens, that's a good chance that you could do that. If not, if you have a broken or chipped tooth, rinse your mouth with warm saltwater rinses. Be very careful in that area and then go see your dentist as soon as possible. And then severe toothaches, that happens all the time. It can happen on the weekend or when your dentist is not available. Over-the-counter pain meds usually work. Tylenol is usually really good, like Motrin 800. Alternate that with your other pain meds just to kind of keep you until you see your dentist. Ice compressions as well. Put some ice around that area. Be very careful. Try not to eat anything hot or spicy. Just softer foods until you see the dentist. And then also elevate your head while you're sleeping. So you don't want the blood to flush all the way go back. So when you're sleeping, try to sleep reclined if you have a severe toothache instead of sleeping all the way back. And then this is just a brief overview of orthodontics braces. Corrects irregular teeth and jaw movement, helps improve aesthetics and oral function. Different types of braces. The traditional metal is mainly for kids, teenager years. And then, of course, there's clear liners and Invisalign, more for adult population, help for minimum movements. So when should a kid get braces? You can definitely go see, there's no like perfect answer because every kid has different bites and stuff, but definitely want to go see an orthos, usually around the age of 6 or 7 to get a consult. I would say early treatment for if they have severe crowding or crossbite. And then usually the best time is around the ages of 10 to 14. Why? Because most permanent teeth are erupted by then, but your teeth are haven't moved enough, so it's a good time to move their teeth. They're not so stable just because they just started erupting. So it's a good time to do braces around the ages of 10 and 14. And then adult ortho treatments usually after 20, more for like functional aesthetic concerns. You just want a little bit of movement. You can do the clear aligners, which is where you wear those trays and you have clear attachments to the braces. And then night guards are important as well. They're indicated for teeth that grind, indicate for people that grind their teeth when you clench your mouth, especially at night. It also helps relieve TMJ and jaw pain. So when you wake up and if you have a really sore jaw or your mouth hurts or have a headache sometimes, that could be because you're grinding your teeth at night. And you can see here I have a sample of a night guard right here. Looks like your teeth just made. It's kind of like a mouthpiece that you wear at night to help prevent you from grinding. Because at night, if you clench a lot, you can also clench away healthy tooth structure. And then you're looking at seeing your nerves and stuff like that. And then that could cause, more problems than not. So night guard's a good way to help prevent that from happening. Okay, so now I'll give it to Sindhu and then she can start talking to you about pediatric dentistry.
Hi, hi everyone. I'm Sindhu. Thank you so much for joining, and thanks Siva for the first part of the presentation and Lakshmi for the intro. I'm going to touch on a lot of things that Siva has already talked about, but make it a little bit more pediatric focused. And if anyone has any specific questions, we'll cover them at the end as well. You can go forward. All right, so I kind of just wanted to start with what is a cavity, just to make sure we're all on the same page. Cavities are completely preventable diseases, which Siva touched a lot on. But the way that this disease really happens is we eat certain foods, often sugary foods, that sit on the teeth for a long time if you don't brush them off or neutralize the environment. And that bacteria we obviously have in our mouth already. So the bacteria feed off of that food, produce acid as their waste product, and then that causes holes in our teeth because our teeth are just minerals. So it's almost like, like a rock, you're having some like acid on it, it starts to wear it away over time, makes a hole. And as that reaches a nerve, as Siva explained, that can cause a lot of pain. So again, Siva touched on a lot of this, but it's especially important with pediatric dentistry. We really try to work on prevention because, as I said, this is something that we can completely prevent ourselves with our habits. So diet's the first step in that. We really recommend kids to avoid candies, sweets, sugary beverages, starchy foods. Of course, it's hard to avoid these completely, but limiting them, eating them with meal times, like Siva said, drinking a lot of water, those go a really long way. I did want to kind of touch on some of the recommended amounts, which are a little bit shocking, especially for juices. Pediatricians and pediatric dentists only recommend 4 ounces of juice in a day, which is a half cup. And they recommend only starting that after a year of age. So until 1 year, like no types of juice are recommended. And after that, only a half cup, which is much smaller than like even I drink. So I know it's very difficult, but just something to keep in mind that it's a very small amount that's recommended by doctors. And just to keep as a standard. Sorry, one more thing about that. In general, with the sweets, if your kids like really want to eat sweet things, meal times are good, but also sweets like chocolate and ice cream are a little bit better because they can kind of melt off the teeth compared to like sticky candies and like chewy crackers. Those kinds of things sit on the teeth, and that's really what causes those cavities over time. And another thing is it's the frequency that's more important, right? So like if you're having it, like if you're sipping on a beverage throughout the day, then your mouth is constantly exposed to like an acidic environment and never being neutralized. So like that's why we're saying keep it to meal times because then you're having that sugary substance all at once, and then after that you can have water and neutralize the environment. And yes, Siva's touched on a lot of this stuff about like recommended stuff like protein rich foods, dairy products, they're all very protective. Okay, so prevention, again, we recommend brushing 2 times a day with the fluoride toothpaste. Um, the most important thing is how much time you brush for, which I've noticed that a lot of people say they brush twice a day, but they kind of just go in there really quickly. So it's a technique like Siva showed, and then the amount of time. I don't know if you're able to refresh the slide, but I did try to add in, it's not that important if you can't, but um, there's a toothpaste that Crest makes for kids, because I know sometimes it's hard for kids to brush their teeth for 2 minutes, and it actually changes color from blue to pink when that 2 minutes is over, and it does have fluoride in it. It is recommended by the ADA. So if your kids are having trouble like knowing when to stop brushing their teeth, like how long to brush their teeth, I'd recommend looking into something like that. And in terms of the amount of size of toothpaste, under 3 years, you really just have to use a tiny bit, like a rice grain size. After 3 years, you can use a pea size. And of course, flossing daily, like Siva talked about. And we want you to start going to the dentist by age 1. Typically, a child's first tooth erupts around 6 months. So at that visit, they'll check, make sure everything's good, go over some of the habits, things to avoid. It's very important that you go to a dentist every 6 months so we can, see what's going on and intervene as early as possible. I just saw a question in the chat asking what sealants are, and that's the next thing I was going to cover. So this is something that we do as a part of preventative dentistry. So if you can see on the side, I have this picture of teeth, and our teeth naturally have like a lot of grooves on them. And these grooves are really natural places for food to stick in the teeth. And again, that causes cavities, as I mentioned earlier. So one way to avoid cavities from growing is if your teeth have a lot of grooves, which most of ours do, your dentist might recommend for your kids sealants. So sealants are a type of filling material. It's more liquidy, so we're able to paint it through those grooves of the teeth. Like you can see in the picture underneath, it's more, you can see it's white in that area. So it levels out the grooves. So you can imagine like a mountain is it like the tooth is like a mount, the cusps of the tooth are like mountains and the grooves are like little valleys. So this comes and like fills the valleys and makes them more shallow. So now food won't be able to stick and get caught in there as easily. And even if it did get in there, you can kind of brush it off more easily. So that's something that we really do encourage to help avoid cavities from growing because those are high risk sites. And then Siva touched on mouth guards, very important for kids, especially if your kids are playing a lot of sports that are like contact sports. We see a lot of kids that come in with dental trauma, like tooth fractures, teeth falling out, teeth moving, and mouth guards can go a long way in preventing that, and you can get them over the counter. I wanted to go over some of the treatments that we use a lot in pediatric dentistry. We do almost everything that Siva also talked about, but often with kids, we have like behavior issues. A lot of kids are afraid of the dentist. They're not able to sit in the chair for long enough to get complete treatment done. So we do have different techniques that we use that are good for you to be aware of if your kids ever need a different type of treatment. So fluoride varnish is a big thing that dentists use in general. Of course, toothpaste, we recommend fluoride in that as well. But when you come to the dentist for your 6-month cleaning, we applied fluoride varnish, which has a higher concentration of fluoride, and that helps like remineralize the teeth. So any starting cavities, they can kind of the size can be limited as we keep applying that fluoride varnish every 6 months. So that's a big thing for smaller cavities. We also do something called Hall crowns, which is on the right. So if you have a cavity and normally, like Siva explained, you would drill out the cavity and then fill it with like a material. Sometimes kids can't sit through that procedure and it's a lot of vibration, it's a lot of water. So sometimes we can choose to just put a crown on top of it without removing that cavity material, like the bacteria. And basically what that crown does is it suffocates. Bacteria need oxygen to be able to continue living. So by suffocating their environment, we basically kill off the bacteria. That's the hope. And we can let that tooth continue to be in the mouth. These have like pretty good success. They don't always work, but it is a good option for some kids if they're having behavior issues. And then on the bottom, this is something that we use very frequently in pediatric dentistry. It's called silver diamine fluoride. Again, it's a different formulation of fluoride. And it also has some silver in it, which has a property that's able to kill the bacteria in the cavities. What it does is it stains the area of the cavity black, as you can see in the before and after picture. But it has very good success rates in stopping the cavity from growing. So even though you're not able to get a filling material in there, we're able to stop the progression of the cavity from getting bigger. Because when cavities get bigger, they can actually travel to the gums. They can start a little swelling in the gums. And then as that swelling grows, it can even affect the face and other aspects of your body. So it can become systemic pretty fast. Is Kramba good for palvali? Um, I'm actually not sure about that one. But I'll get back to you. Okay, and then about braces for kids. So again, Siva touched on this a bit, but I wanted to show some pictures of when it's important to get more early intervention with an orthodontist. So we have phase one and phase two treatment. Phase one is what is done earlier. If you're not everyone needs phase one treatment, but if your child needs like expansion of the jaw, something to be able to correct a big problem before they get treatment when they're a teenager. The teenager treatment is more so just to like align things. But if they need something bigger, we want to intervene earlier. So some examples of that would be like expansion. If you have a very narrow jaw, jaw size discrepancy. So you can see in the top right picture, this child has a anterior overbite. So their lower jaw bites before in front of the top jaw. So we need to help them by expanding the top jaw, bringing that forward, and that's something that can be done more effectively when the child's younger. So that's something that's important to have an orthodontist look at early. And then cross bites, very important that you see an orthodontist early. If you see that your child has a pattern that's seen in this like left image, like a scissor, your your upper and lower teeth kind of bite like a scissor. If you can see here, that lower tooth on the left is in front of the one. I don't know if you can use the cursor there, Siva, to show the cross. No, sorry, I mean on the left picture, the anterior crossbite. Yes. Yeah, right there. The number 24 is in front of number 9. Yeah, there you go. All right. And then having a large overjet, which you can see in this picture on the right, the upper teeth are very forward compared to the lower teeth. And sometimes those kids can't close their lips all the way, so that you might see them kind of breathing through their mouth. And that puts their front teeth at high risk for trauma if they're ever to fall or hit something. And then also the mouth breathing isn't really recommended just for your systemic health either. So that's something that's very important to get corrected early as well. And then dental emergencies that I see a lot with kids. If you ever notice that your child's like bleeding a lot from the mouth and you're not able to stop it, that's like an indication to go to the emergency department if it's after hours or like a dentist if it's during the day. But often we can control this on our own at home. We recommend like getting some gauze or like paper towel and holding pressure for a long time, and that usually does stop bleeding. But obviously, you want to go to the dentist afterwards to see what might have been causing it. We see a lot of tooth trauma, so kids break their teeth while playing sports, playing outside. If you ever notice, like in this picture I have, that little red, you can see the little red part of the tooth, that means that the nerve has been exposed. It's very important if you notice that to get to a dentist as soon as possible. Again, if it's after hours, we do treat those like in the emergency department. They always have like a dentist on call. But sealing off the nerve as soon as possible will help make sure that that tooth can stay in the mouth and doesn't have issues down the line. Again, has a variable success rate, but the earlier you're able to catch it and treat it, the more effective that treatment can be. So you don't want to just leave it out open to the environment. Also with trauma, sometimes kids will get hurt and their teeth will move and you'll have a little bit of mobility. Again, if you go to the dentist, they'll put a splint on the teeth, kind of looks like braces, but it's a temporary splint for about 2 weeks sometimes, helps hold the teeth in place so that the teeth can heal. It's like a bruise. Your teeth will hurt for a little bit, but until the bone can form around it, we help stabilize it so that the bone can form, stabilize it again, and then we'll take the splint off. Siva did touch on avulsion, which is when the tooth fully falls out. I wanted to add to what he said. So if you're able to, at the site, when you notice that a kid's tooth has fallen out, it's very important, one, to recognize whether it's a baby tooth or an adult tooth. You'll probably know baby teeth are much smaller. They're a little bit more white. And the adult tooth just looks bigger and a little bit more firm. So you want to hold the tooth by the crown, so the part that you can actually see, not by the root. The root is a little bit more yellow. So you want to hold it by the crown, And if you're able to, lightly rinse it with some milk or saliva. And if it seems like it's clean, like you don't see any visible debris on it, it's actually best to reimplant it, put it back in at the site that it fell out, because you want to put it back in as soon as possible and then go see the dentist. But if you're not confident in doing that, or you're not like confident that it's fully clean, then as Siva mentioned, you want to keep it in like a Ziploc bag with milk or saliva, and then bring it to your dentist. But it is actually, it's very time sensitive. We try to get it back in within 60 minutes of it coming out. So if you're able to get it in yourself, we can always like reposition it a bit, but it's better if you can get it in yourself. And then lastly, we do see that kids that get a dental infection, as the cavity continues growing and we don't treat it, we notice that, like I was explaining before, you might notice a pimple by the gums that becomes a facial swelling. If it's a small local pimple by the gums and you notice that, you want to bring your child to the dentist. But if that gets bigger and you notice some swelling by the cheek, going up to the eye, or like under the jaw, like going under the jaw, you want to bring that patient to the ED, for them to take a look. Think that's all I had. So if anyone has any questions, um, please feel free to ask.
Yeah, I just want to say thank you to everyone logging in, and thank you for the H&H committee as well for help. Yeah. And now we can do the Q&A session kind of.
I know that we wanted to talk about the results of the poll, if you want to start with that.
Yeah, let's
I
do that.
can't see
Yeah.
it, but
Uh,
Can you stop sharing the screen?
yeah, yeah. Okay.
I'm seeing the.
Yeah, I can see it. Yeah. Yeah, yeah. Okay, this is good. So, it seems like over 50% has seen the dentist within the past year, which is good. And then 38% less than 6 months, which is even better. So overall, pretty good. If you want to make this more, I'd like to see more people see the dentist within 6 months. So you want the first one to be a little bit more like 60 to 70%. But yeah, this is good. This is good starting. But definitely people who haven't seen a dentist for more than 2 years, please go see your dentist. You want to see them definitely every 6 months. It's important just to make sure your teeth are good. Even if you don't feel any pain or anything, you never know until you take x-rays to take a look and see if there's anything going. So yeah.
okay. I see a couple questions in the chat that we can start with, and then I have a couple questions. Someone's wondering where your clinic is.
Oh, my clinic. So I work in Atlanta. I'm in Collier Hills Dental in the Midtown area. So that's where my clinic is. Yeah.
So if you
Yeah.
guys want to see him, that's where he is.
Yeah.
Okay. I had a question about the correlation between, I think we talk a lot about health in terms of like primary care, like heart health and stuff like that. So how is that related to dentistry, and why is it important to care about both? I know both of you guys touched on this a little bit, but if you
Yeah,
have anything
I
else
guess I
to
can start a
add.
little bit. I did mention like so patients that are diabetic, have heart disease, are of a higher risk of having dental cavities. Why is that? Just because they have more bacteria flowing in their mouth, and so it's important to see a dentist if if you're diabetic, just because your healing process takes longer. When you eat sugary food, it kind of stays on your teeth a little bit longer. And if you have heart disease, you have a higher risk of having periodontal disease, which I kind of talked about, which is the gum tissue area. So bacteria flowing in from the gum tissue in the bones can cause, getting into your heart. So it's important to see a dentist to make sure that's all clean, so you're not getting infections that are getting into your heart that can cause increased risk of heart stroke, stuff like that. So it's very important. There's a lot of systemic connections between oral health and the overall health being, but heart disease and diabetes are a major risk factor.
Okay. I have another question. So I know a lot of our, like many South Asian diets are typically high in carbs and sweets and a lot of the foods that you guys told us to avoid. So what are some realistic ways? I know you talked about eating them together, at meal times, but what are some realistic ways that we can protect our teeth without completely giving up any of our cultural habits?
Yeah, I always say if you're having sweets, I mean, of course, we all love sweets. I do too. Try to limit it to 3 times a day and always eat the sweets with your meals if possible. So now right after lunch, if you want to eat ice cream, it's a lot better than waiting in the evening and just having that. And then just, always brushing and flossing more. So if you're eating something that's heavy, it doesn't hurt to brush your teeth right after a big lunch or a big dinner, just to help prevent the cavities from progressing. I think main thing is eating right before you go to bed, eating ice cream and not brushing your teeth will definitely cause problems because that's when your mouth is closed and bacteria grows. So you want to try to brush like right away after eating the sweets, or try to eat it together with a bigger meal. That's probably my tip.
I was also going to say, I feel like me and a lot of dentists do have like a very sweet tooth, so I definitely do eat a lot of sweets. I just make it a point to like drink a lot of water after I do, and like
Mhm.
like literally rinse my mouth with water if I'm like outside. It's not really recommended to brush your teeth right after you eat something sweet because you can kind of spread around that sweetness. But really neutralizing your mouth of that like sweet right after goes a long way, I feel like.
Yeah, water is always good. Water is always good after.
Is water the main fluid that like neutralizes the teeth in? Oh, cool. Nice. I didn't know that.
Mhm.
Um, Also, we know that dental care can be expensive. So what do you guys think is the biggest return on investment in terms of preventative dental health?
Biggest return on investment. Always go see your dentist twice a year. It helps prevent them having major problems, right? If you only go see your dentist for like, a toothache, that could cause an extraction, implant, can be expensive. So if you see your dentist regularly, that can help prevent those bigger problems. So it's always one of those, it's a catch-22. You do see your dentist, you have to pay every 6 months, but it helps prevent major problems kind of thing.
I think there's some questions coming in the chat.
Yeah, I know. Let's see.
I
Yeah.
also did look up Krambu and it's so that's actually clove and we actually do use there's there's like a dental product that we use as like a temporary rest like filling that has that like clove material in it like eugenol and it does have like there is evidence that it helps like calm the tooth down when you're in a lot of pain. So I haven't heard the, what like the use case for Kromba for like toothaches, but I'm assuming if we have that material that has clove in it, and I've heard that that helps a lot. I'm assuming that can't hurt. I don't think
Yeah.
it's something that I would do instead of getting the dental work done, but it's something like, like a salt water rinse. If that helps you, if you feel like it gives you some relief, I would recommend it for sure.
Yeah, definitely. I've seen that oil pulling kind of clove thing you can put around your tooth helps. You also can get like a numbing jelly. It's like benzocaine over the counter and just kind of rub it around. Definitely helps like, calm the nerve a little bit before you go see your dentist. Yeah.
And then somebody also asked about denture cleaning and how long they should change the denture after.
Yeah, so denture cleaning, I always recommend cleaning your denture every night before you go to bed. Make sure you're putting it into like a glass container with water, and you can even get those denture tablets that you use, and you put it overnight. That helps really well. Or you can get, you can even use your brush and normal toothpaste also and clean the denture out. It's very important the denture is clean before you put it back in, because you don't want the bacteria to kind of settle in there. And then always take out your denture or partials at night. Don't sleep with them because that can cause a lot of gum soreness and problems like that.
I see one question that asks if we also have to brush with a 45-degree angle if it's an electronic brush.
Yeah, I
Yes.
think no, sorry.
Yeah. You can go ahead. Go ahead.
The angle is more so just to make sure that you're targeting both your like gums and your teeth at the same time. You don't want to have it like just head on. It's a little more abrasive. So yeah, whether you're using an electric toothbrush or a normal toothbrush, we recommend that.
Um, and then I see a specific kid-specific question. A lot of kids' toothpaste is fluoride free, so what is recommended there?
Yeah, I saw like two questions about the toothpaste, like the herbal
Yeah.
toothpaste, and then also like the kids. Like we mentioned, like definitely recommend a toothpaste with fluoride in it. That's like our gold standard in dentistry. And I know there's a lot of contention about fluoride, but it's been proven multiple times to reduce the amount of cavities, the risk for it, and it's very beneficial. So it is a naturally occurring mineral, and we're using it in small controlled dosages that are healthy. They haven't proven to have any toxic effects. So yeah, definitely look for a kid's toothpaste with fluoride in it. Like there's Crest, Colgate, all of them make kids toothpaste with fluoride in it. Kids can also use normal toothpaste, but I know like kids toothpaste can be more fun if it's colored or bubblegum flavored. But yeah, they definitely have fluoride in them. And yeah, I think with the herbal toothpaste, I personally don't use them. I can't advocate for it or against them, but I would strongly say like use a toothpaste with fluoride in it.
Yeah, I agree. Any toothpaste with fluoride is probably better just because it has that mineral. Fluoride's the only mineral that we have that can help remineralize your teeth. So it's really good to use that. It's probably better than just natural toothpaste.
There's a question about wisdom teeth. Is it important for them to be removed? And if so, is there a specific age?
Yeah, that's a
Yes.
really
So
good question.
yeah,
Go, you
go
want,
ahead.
sorry, I can start and then you can add on because I feel like you
Yeah,
put
yeah,
other
yeah.
things.
Mhm.
Yeah. So in terms of age, like typically under 24 is when we want to take them out. It doesn't always need to be removed. It's really like a case by case basis. So definitely important that you go to the dentist and have them take a look at yours specifically. The reason for a lot of dentists recommending to take out wisdom teeth is because they have a high likelihood of causing problems down the line. And because it's not really recommended to take them out after 24, because it's a lot harder to heal, you can have more nerve damage issues. That's why we like to take them out before we reach that age. So the dentist can look at it and see, is your situation one that this might cause problems? And if it is, they might recommend that, hey, I would take these out just so it's not a problem down the line. But they look at your teeth and they're like, actually, you know what? These are kind of in a position that they'll never bother you, even if they come in, whether they don't come in, you can just leave them in. They'll tell you not to. So that's kind of my perspective. Yeah. What do you think, Siva?
Yeah, same thing. There's no like age range. I mean, usually after 18 is when your third molars erupt, but it just depends. Some people have wisdom teeth that come in straight and they're great. You don't have to take them out, but it just depends on how the teeth are erupting. They could come sideways or a little bit, and it's better to get them out sooner rather than later because if you let them in, they could start impacting your other molars, which means that you might lose more than just your wisdom teeth. So it's just one of those things that you have to go see your dentist after a certain age, and then they can kind of do a consult with you and let you know and see how they're erupting. But there are a lot of people out there that have their wisdom teeth and are completely fine. So it's just a case by case basis.
Nice. Good to know. What about drinking from a straw versus drinking from a cup? I know you guys said that drinking from a straw is better for staining, but also I've heard that you shouldn't drink from a straw because of like how your like it makes wrinkles around your lips. What do you guys have anything to say about that?
I mean, I think drinking from a straw is fine. Just like sometimes some people, like when you drink from a straw, they get the plastic in their teeth kind of affects it, but it does help with staining. It does, provide an easier way for it to go straight into your mouth. It's not getting into your teeth. So drinking from a straw, especially stainless steel straws are good. Stuff like that. I don't see an issue with straws. How about you, Sindhu?
Yeah, I mean, I drink
Um,
with a straw. I would recommend it.
yeah, I think it's fine.
I guess I'm not also worried about the wrinkles. So
Yeah. I know after you get your tooth pulled, we recommend not drinking with the straw because you don't want the stuff to get into that extraction site. But in normal times, yeah, drinking with the straw is fine. There's no issues with that.
Great. Someone said since tap water has fluoride, do you recommend drinking tap water?
100% yes. For the same reasons, because fluoride is very beneficial.
Yeah, fluoride is good. If the tap water has fluoride, that's great. But if not, bottled water, stuff like that definitely is good. The more fluoride you get, I mean, obviously don't over fluoride, but like the more fluoride you have in your mouth, it helps remineralize your teeth. So yeah,
Cool.
some
Um,
of them do.
oh.
Sorry.
How can adults who have avoided dental care, I know sometimes it can be kind of embarrassing to go to the dentist if you haven't been following the 6-month rule. So how can adults safely restart appropriate dental hygiene and or is it ever like too late?
I would say it's never too late. You got to start somewhere, right? And just try to go in, try to make sure, even if your teeth's not hurting, but you haven't been to a dentist in a long time, there's a lot of other problems that we can detect without, causing issues. So it's good to always check. It doesn't hurt. There's no judgment. I mean, we see patients from all over who haven't seen dentists in like, 40, 50 years, and we see patients that see dentists all the time. So it's just um, the sooner the better, and you got to start somewhere. So that's about it.
Oh, and also I think someone has a question about teeth whitening, which I was curious about. Do you recommend using whitening strips, or like what are some options for teeth whitening? Is it
Yeah.
safe?
Yeah, so in my office or in most dental offices, there's usually three options we recommend. The first option is always te whitening strips, which you can kind of get over the counter in Costco, Walmart, wherever. Those are temporary use. If you're having like a big event or something like that, you want your teeth to be white, you can use those. They do a pretty good job, but they're very temporary. So kind of like for a week or 2 weeks, and they kind of go away. If you want something more permanent, then we do whitening trays where we take impressions of your mouth. We have a model of it, and then we can give you the gel to use, and that you wear a couple of times a night or during the week. And that's like 10% hydrogen peroxide. It's very safe, and that does give you a good result. A couple of months to kind of last you, and you can wear those trays a decent amount of times. And then the most dramatic results, usually the in-office whitening, where you kind of sit with your hygienist for about a couple hours. We do the gel, and that gel is a little bit more invasive. It's like 30% hydrogen peroxide. So there's a lot of bleach in there. So in that you can kind of see instantly the results. And those last a little bit longer, almost 6 months to a year, if you maintain it properly, kind of thing.
Do you think mouthwash is essential to the routine, or is that more not cosmetic, but more up to user preference?
I would say it's like a supplement. It's not like a necessity, but it's definitely like a very helpful aid, especially if you're not able to, like, anything's better than nothing. So like if you're not able to brush your teeth twice a day, or I think it's a very like helpful like additive to have. But I honestly don't use too much mouthwash. I just brush my teeth really well twice a day and floss daily. So I wouldn't say it's like a necessity, but
Yeah,
yeah.
mouth rinse is kind of like chewing gum. It's like another additional thing to help prevent bad breath, but it's not like a alternative to brushing and flossing. So it's one of those things you can add. Doesn't hurt, but it's not gonna be the one that helps you, kind of thing.
Great.
Yeah, and then somebody just asked about bad breath actually. So, yeah, I think that mouthwash helps a lot. In general, like bad breath can be because of like low salivary flow. So, like if you're not drinking enough water, your mouth gets dry really fast. So, like increasing water intake, mouthwash can help. There's like gum with xylitol in it. Those can help like freshen your breath. And another thing some people don't realize, you want to like brush your tongue as well, or like use one of the tongue scrapers, because sometimes like food and stuff can collect on your tongue and that can cause bad breath as well.
Yeah, for sure. And sugar-free gum. If you're going to do gum, make sure it's sugar-free. And that definitely helps with breath. And then also tongue scrapers. I mean, your tongue it's a lot of bacteria in there, and that can cause a lot of issues. So definitely scraping your tongue at least once a day helps as well.
And then I just noticed we missed a question about oil pulling. I have like I don't know too much about like the research behind it, but again, I would say it's like an additive to like all the recommendations we've said today already. Like in addition to brushing, flossing, I don't think it hurts. I'm not too familiar about which like oil is the best to use, but I have heard that people use coconut oil commonly. But again, like I'd recommend using that in conjunction with the other techniques.
I also saw another question. It's asking about is a water floss better than the traditional floss? It's kind of like an electric brush versus a manual brush. I mean, they both do the same thing, but if a water flosser it's a little bit easier to go in underneath your, the back of the molars, kind of clean it out more compared to your traditional floss. So it's kind of up to you, but yeah, water flosser is becoming more common just because it's a easier habit to go in, kind of thing.
And then someone asked about when we need to replace a bridge and how long it's good to have it. Again, I think that's more on a case by case basis. I would definitely have a dentist evaluate it. If you feel like that bridge is like causing you pain, or you're not able to chew properly, it's like shaking. Those are all indications that you know that something's wrong with it and you can go and get it checked. But every time you go in for a dental exam, your dentist is going to check like if the fillings and crowns and bridges that you have in your mouth, if they're looking good still. And if they're not, they'll recommend whether you need to replace it or not.
Yeah, I agree. And that's why we take dental x-rays. So it's very important you take x-rays every year. It's actually legally dentists are required to take x-rays just so we can see what's going on underneath the crowns, bridges, teeth, gum tissue, like so we can detect infections that we can't see in our mouth. So that's why it's another important thing to take x-rays once a year.
But we have some questions from the room.
Yes.
Yeah.
You wanna come? Yeah. Okay. Yeah, so we have a question here. He's asking, he has braces, so he's wondering if electric brush is better or a manual brush. I personally think an electric brush would be better just because you can go in underneath the braces because you have brackets. It's hard to do with the manual brush. An electric brush means you can kind of go in a little bit and cleans a little bit better. So I would say an electric brush is probably a better option if you have braces. Yeah.
Also,
Uh,
Awesome.
sorry, I was gonna say I'd also suggest the water flosser for somebody with braces because it helps you get in between the teeth.
Yeah.
I have a question for Sindhu. Maybe this is already answered, I'm not sure what. In one of the slides, she did mention that starch is something you need to avoid, whether bread, rice, pasta, whatever it is. So that's something we consume a lot. So what is the recommendation on that?
you want to go back to the
Yeah.
see if we can present.
Maybe you, I don't know if Sindhu got it or not.
He is bringing the presentation as well as the improvement.
Hey, could you repeat the question?
Yeah, I think, Uncle, do you want to? Yeah.
Second slide.
Second slide.
Second slide.
Spaghetti. Yeah.
Yeah, the limit starch, right? Like that's something we consume a lot. Cereals, bread, pasta, rice.
Yeah.
Yeah, so what is the recommendation there? Just want to understand it.
Yeah, I mean, I don't have like a exact number or anything, but in general, just like, rice, cereal, bread, and I eat all these things every day, and we all do. But those starchy foods, they have like a lot of carbohydrates and they sit on the teeth. The sugars are broken down by the bacteria and they cause cavities. So I'm not saying not to have them, but it's more so having them in moderation and having water afterwards, doing things to like clean them off of the surface of the teeth, because those are what cause the cavities, as opposed to like if you're eating like a vegetable or something that's less likely to do that. So that was more my recommendation, not to avoid. In general, like I don't think it's like I'm never recommending for people to avoid eating things that they're habitually eating. It's more so limit and see how we can work with their current diet.
Got it. Thank you.
Yeah.
Any other questions?
Does anyone have any other questions?
I have another question.
I just want to say thank you, Siva and Sindhu. That was very useful information, and thank you for your time. Question about what Sindhu said for sealants for kids. What are the general criteria where you would start thinking about doing a sealant? I'm sure it's not for everybody, and how often would you have to do that if you do use it?
Yeah, good question. Yeah, agreed. It's not for everyone. Like if you're going to the dentist and like you've never had a cavity, typically I don't really recommend it for kids that I am confident they can keep their teeth clean, and their diet's pretty healthy or they're doing a good job managing it. I kind of recommend it for kids who I consider a higher risk for cavities. So there's certain factors that play into that, like they've had cavities before, or they're eating a lot of sugary foods, and I know that they're not brushing their teeth. So those kids, I want to protect their adult teeth. So the adult teeth start growing in around age 6. So I'm going to be pretty quick to be like, okay, let me go ahead and get some sealants on this to make sure that we don't develop cavities on the adult teeth going forward. So yeah, it's again a case by case basis, based on your child and the dentist recommendation. In terms of like how often to redo it, typically like sealants, like ideally they won't fail, but sometimes they do. And I think it based on the insurance, it's either covered every 3 or every 5 years. So if I feel like a previously treated sealant hasn't like it has like a defective margin or something, I'll usually retreat it if it's going to be covered by the insurance. If it seems really defective and it's one that I placed, I might like talk to the patient about like redoing it at no charge. It really depends on the situation.
Yeah, and sealants are mainly for kids. Like usually after the age of 16, it's mainly if you need something, we usually do a filling material. Sealants are just more protecting just before it gets to that point.
Yeah, so actually they're usually only covered up to like age 14 for
14.
by
Yeah.
insurance. Yeah.
Yeah, 14. So after that, usually you get permanent teeth, and then if there is deep grooves and stuff like that, we usually do like a filling material. Yeah. Mhm.
There's one more question.
Yeah, I think someone online, sorry to go back to online, but someone online is wondering if someone has a broken tooth, what is the fix and how long would that fix last?
Like broken in the sense that it's fully broken, or like how uh, we're not
Yeah,
sure.
I
Okay.
guess like, it really depends on
Yeah,
the case.
yeah, we can't really tell just by, I mean, we don't know, I mean, broken tooth could be anything, but if your teeth is fully broken, and it's basically needs to come out, I would say sooner rather than later, even if it's not causing pain, because it could start forming infections in the gum tissue and your surrounding teeth. So it's best to go see a dentist to see what's going on, and then remove the remaining part of the teeth and replace it with something if needed, kind of thing, I would say.
They're saying half broken.
You're saying half broken?
Yeah.
Okay. Yeah, then definitely I still we probably you could probably fix the tooth maybe with a crown. Just still depends on how much tooth structure is left. So I would definitely go see your dentist as soon as possible and then see if we can try to save the tooth because you don't want it to break even further and it could cause more problems.
Broke mine, but they didn't fix it, so I have to put it down.
Okay. Yeah.
That's the question. So because
Yeah.
an angle, so
Yeah, it just depends like how it breaks, how much tooth is left, how's the root and everything before we can determine if we can save it or not. Yeah.
And the success really depends on like of course the size, but like if the nerve of the tooth is affected,
Mhm.
sometimes there's like less likelihood that the fix might be a long-term solution and you have to kind of monitor for symptoms. So yeah, it's really case by case, but yeah, seeing a dentist as soon as you can is the most important thing.
Yeah. Yes.
Depending on it's are some of them more prone to cavities? Because like of the two that I have, my older one was more regular in brushing. She had more cavities than my younger one who was not regular.
Yeah.
Just curious to know, is it that like some of them are more prone to get cavities?
Yeah, so the question, I'm not sure if y'all heard the question, but it's a common question. Basically, she was saying she has two kids. One kid brushes a lot but still gets cavities. Another kid doesn't brush as much but doesn't have as many cavities. Is it just because some kids are more prone to having cavities, or it's just kind of like just the brushing technique? Do you want to talk about it, Sindhu, first? And
Yeah,
then
I mean, I think all those could be at play. Like, even if they're brushing more, we have to see like how they're brushing. I often like to like watch kids brush and see if they're actually doing a good job. The fact that they're trying is a good sign because then probably if somebody can show them the right way of brushing, maybe that could go even further. I don't know if there could be diet inconsistencies between the kids, but there actually are some differences even just between like the bacteria in each of our mouths. So, um, there is a chance that like the type of bacteria that causes cavities is like kind of higher in one kid's mouth versus another. So yeah, all those kind of come into play. I know it's probably like frustrating to see that the kids who's trying more is having like more cavities or whatever, but
yeah.
yeah, trying to get to
Yeah.
the bottom of it will be helpful.
Yeah, having cavities, it's a lot of factors involved. It's not just one thing. Genetics also plays a role. Just some people have softer, smaller teeth, some people have bigger teeth, and some people just have tendency to get cavities faster than others. So it just depends. There's really no one set all be all rule kind of, but as long as you're maintaining it and then making sure that happens, it's good.
So when to use medium and hard
Missiles. I personally would not use those. I would always stay with the soft or ultra soft because medium and hard is very aggressive to your teeth, and that could break away like enamel and tooth structure. So then you're actually doing more harm than good. So I would say always soft or ultra soft. Because we have a tendency to be very aggressive when we're brushing. So you want to be soft, because if you go too hard, you can brush away healthy tooth structure. Yeah.
But the sound doesn't make a feel like a brushing.
Yeah.
So,
Yeah. Because when you're brushing, we're not really brushing mo much. You don't have to put too much pressure. We're just brushing the plaque around the teeth. So we're not really cleaning too much. We're not like, yeah, we're just kind of going on the surface to remove it. Yeah, we don't have to go full on this. So I will always recommend soft or ultra soft, honestly. And then the electric brushes, their heads are always soft. So that's good. But yeah. No, no problem.
I think electric, there's no category like a soft, medium, or I think.
I think it's just soft. Yeah, just straight soft. Yeah. Mhm.
So, with the electric brushes, how often should we replace the heads?
Yeah, so that's a good question. She just asked, how often do you replace the heads in an electric brush? And I would say that I mean, of course, depends on how, you have to look at the brush, like the head of the brush, and see if it's fraying a lot. I would say within 3 to 6 months is usually good. If you have a manual brush, 3 months, but electric brush, you can go a little bit longer. But just check the bristles and make sure it's not fraying or spreading out, kind of thing.
I mentioned about the whitening, it doesn't actually, the whiteners don't actually whiten your teeth. Instead, they just do something.
Yeah, so you can see he was asking about whitening. So whitening toothpaste doesn't really whiten your teeth. That's just to help strengthen the enamel, which is the white part of the tooth, but it doesn't really whiten it. So whitening toothpaste is just like another, so it's saying healthy, like making your teeth healthier. But if you want actual whitening, over-the-counter whitening strips are the best, like little strips that you use, and you kind of put that over your teeth. Or you can go to the dentist and get the whitening trays, and they'll give you the gel to use that you place overnight, I think. So those are the best ways. Sorry?
Those are coatings?
Yeah, coatings. Yeah, little coating trays that you get from the dentist, and they'll give you, it's like a hydrogen peroxide, the kind of thing, and you put it there. That's probably your best option. But whitening toothpaste is more like just to get your teeth healthier. That's not going to really increase the color in your teeth.
So, I question the sealant, I think, I was just driving, I was in the video. And Sindhu were talking about, she's telling the sealant thing. So the sealant prevents cavity, right? So meaning, I mean, when the kids are growing up, and every time I go, every single time it's more and more cavity, right? So I don't know if they really do a practice of putting sealant, or they will do only if they ask for it.
Yeah. So he was asking basically about sealants. He was saying every time you go to the dental office.
It's more and more cavity. Is it something we need to ask the dentist to do a sealant, or they always do it?
Yeah. So they basically are asking like, do you need to ask the dentist to do the sealant, or they kind of like recommend it for you? Do you want to kind of?
I mean, it's not, since you know about it, you can definitely ask if a sealant is indicated for your child. Maybe the reason that they're not recommending it, I don't quite know for sure, but sometimes like let's say they have a cavity on this tooth already, then I would do a filling. I wouldn't do a sealant because the sealant is only to protect a healthy tooth. It's like putting a cover on a healthy tooth. But if it already has a cavity, then you have to take out the cavity and fill it up. So maybe that's why they're not choosing to do the sealants. But I think you can definitely go ahead and ask them, like, hey, like if there's any teeth that would benefit from a sealant, especially if your child's under 14, like I think it's worth asking.
We've been doing that in the recent years, so
Oh,
five,
God,
6 years ago,
no.
we used to go there to protect them, but lately they are recommending.
Oh,
every-
only the recent, yeah, they.
Yeah.
Okay, that's the reason, okay.
Yeah. I mean, sealants, it doesn't hurt to ever not have a sealant. It's just some patients don't need it. Like it's just different.
It's a new thing, the last 4 or 5 years. No.
I don't want to say it's new. It's probably becoming more and more popular kind of thing in the sense.
They'll ask every year.
Every dental physician or something.
Yeah, insurance.
Yes.
Insurance, don't have it covered.
Yeah. Yeah, because it's always protective measure, so it's not going to hurt, kind of. But it's just more. I think it's becoming more and more popular to have sealants, especially in your back molars. Yes.
Choice to put a bridge or not?
Yes, that's a good question. So he just asked about a bridge. is there like a choice when do you put a bridge or not? So when you lose a tooth, you have two options, right? You can replace it with a bridge, which is kind of like this one here, where it's a fake tooth in between, or you can replace it with an implant. An implant is more of a single tooth option. So you lose a tooth, we put a screw in there in that area where you lost it, and then you place a crown on top. We're not touching the teeth in the front or the back. A bridge is more where we're actually grinding the tooth in the front and the back and replacing a fake tooth in between. So it's like three crowns put together. So a bridge and implant, I would say an implant's more popular because we're not touching your adjacent teeth. We're leaving those alone. A bridge is more useful if the adjacent teeth needs work as well, then you do a bridge. But if you're just replacing one tooth and everything is normal, I would say an implant's a better option, I think. But implants do take a little bit longer to heal. It's more of a 6 month process. Bridge is more like you go into the dentist and you can kind of dead it in a few weeks. Yeah.
So how important it is to consistently wear my retainers after a race is treatment? I often forget to wear them over.
How often is it to?
Consistently wear my retainers after a race is treatment. I often forget to wear them over.
Yeah, it is important. I would say at least a couple of days a week if you can't do it every day, because you don't want the teeth to move back to how they were in position. So it's important to wear it a few days a week. But I would, in the beginning, wear your retainers a lot, but after a year or two, then you can kind of like stop wearing it every night, probably go 2 to 3 days a week because the teeth are not going to move as quickly. But you do want to wear retainers because teeth will start moving back to their original position if not.
I think someone's also wondering if deep cleaning is good every year.
Yeah, so that obviously depends on your gum tissue levels. I think I kind of talked about periodontal disease in this slide. Let's see here, the very beginning. Yeah, so periodontal disease, you can see, so this is the gum tissue around your tooth. You like to have healthy gum at a certain level above your teeth, but once you get periodontal disease, your gum tissues are recessed and you get a lot of bone loss. And so you want to have a deep cleaning to clean out those areas that you can't get with your brush. That's why the hygienist needs more time. They go in deeper into the gum tissue, remove all that tartar calculus buildup so they can regenerate that pink stuff to bring it back to healthy levels. So a deep cleaning is recommended, but you only have to do it once and then you go see your dentist more often, like 3 to 4 months to help maintain everything. So that's kind of how it is. Just 'cause imagine like having a house and then the foundation is crumbling. You want to have a deep cleaning to help protect it before you can put any before so the teeth can grow and become healthier.
Also, someone's wondering if cold water is bad for your teeth.
No, cold water is fine. I would say like don't make it too cold, but cold water is, I don't think there's any problems with that. But I would say another thing, people sometimes chew ice cubes. I don't know, it's becoming a popular thing where they just chew the ice, and that's really bad for your teeth because that can fracture them. So if you're trying to chew ice cubes, that's not good because then your teeth can break. So just another thing, try not to chew ice. But cold water is fine. I don't think it's a problem.
I have a question about the color of the toothpaste actually in Sweden, right? And there are four colors that you generally say, whether it's red or black or green. Generally, dentist recommends, okay, you have to have a green one because it is all only made nothing of chemicals. So, is there anything actually we checked out?
The color of the toothpaste?
Yeah, on the backside of the toothpaste, there's nothing except that. So, you see, actually, there will be four colors in there.
Oh, I don't know that.
No?
I don't know.
In India, that's all actually
Yeah.
is to say. Four colors in general. So if it is all black, then you're not supposed to use it because it's made of only chemicals. But if it is a red, it's a mix of chemicals and herbals. But if it's fully green, it's herbal. It's all fully made only of herbals. Actually, nothing else. There's no chemical anymore. So that's it.
Right.
I think the fourth one I don't know. But the three colors I know is red, green, and black.
Okay. With toothpaste kind of?
Yeah, on the back side of the paste actually.
Okay.
No, everybody will get all, but in general.
Yeah, Yeah, is that in, it's like all,
I don't really,
okay.
I don't know. I know that because one of the print that I just say that.
So the question was, apparently the color of a toothpaste, like it tells you if it's like red, green, or black. If there's a better color to use. Do you know anything about this, Sindhu? Or
Wait, there's the toothpaste come in different colors and asking which one's like best out of the colors.
yeah, like the
Yeah, kind of, right. So,
Yeah, I don't.
on the top, or actually, if you reverse the paste, actually you go on black side.
okay. I mean, I would always with toothpaste always look if it's ADA recommended. So you can even see this one has American Dental Association. I think red is good. I've seen red. I would say black is not probably. Yeah.
I've seen
Um,
green too.
green is fine. Yeah, I'm not sure. I've been really, yeah,
I've
I
never
always
seen
just
black toothpaste
I've
that
never
I'd
seen
recommend.
black colored toothpaste, but yeah. I would say red and green, blue maybe is fine. But as long as it's ADA recommended, it'll tell on the box. There's American Dental Association, then it should be good. Yeah.
The charcoal, the brush is good.
No, so charcoal is not good. That's the black toothpaste I've seen a lot. I personally would not recommend it because it's too abrasive for your teeth, so I wouldn't do that. Yeah. Okay. Any other questions or anything?
Someone's curious about using mouthwash every day, if that is bad.
Just what we touched on earlier, not bad. I like we actually recommend mouthwash. It's just not something that's necessary if you're able to brush your teeth properly and floss as well.
Awesome. Yeah, I think like a lot of the questions have been around like sort of
Mhm.
myths and like, so how do you guys suggest that someone who isn't as educated approach different like dental hygiene myths? Is I know you were talking about like recommendations from the ADA. Is there like any resources that we should look on specifically online or something like that?
I would say like ADA recommendations. So any website, make sure it has like the ADA logo in it. I mean, going to a dental office, like they're usually dental professionals there that are teaching, so their advice is always highly recommended. And then yes, because sometimes social media can kind of tell you a lot of different things. So it's always good to make sure it's from the official ADA recommend. I know there's a pediatric association as well. And then just asking a dental professional for advice, dental hygienist or dentist, usually is your best way to make sure, if everything's true, kind of. Mm.
I'm looking at the question about neem. I'm just looking it up a bit. It seems like it's like another just helpful like herbal ingredient for like gum health and stuff. So again, similar to the recommendations with oil pulling, like I think it's something that you can definitely use, but I would not use it in substitution for a fluoride toothpaste. But maybe if you want to use it in addition to, I don't think that could hurt. That would be my recommendation. And then gum lifts. I actually don't do any of those, so I'm probably not the best to answer, but um, yeah, I would say that's a very case-based question. Some of those aren't necessarily cosmetic. It could be for like the te health of the tooth as well, to like help hold the tooth in the mouth. They might want to, help support it with a little bit more gum tissue. Um, yeah, maybe Siva can speak a bit more on it.
It's about gum lift surgery, kind of.
Yeah, somebody else.
Gum
I know it's
grafting.
cosmetic dentistry. Just curious, is it good to do gum lift?
Again, it depends. It's kind of if your gums are receding a lot and a lot of the tooth is exposed, gum grafting is usually pretty good to help, prevent the sensitivity and bring, healthy, bring that gum tissue, which is important for the foundation of the tooth. So yeah, I mean, it's not only cosmetic, it's also help for functional purposes. But it's also something we have to, take a look and see. But it does help prevent, getting root sensitivity and stuff like that.
Okay, I think we covered some pretty and interesting questions. Thank you guys for participating, and also a huge thanks to the speakers. I feel like we can all take away from today's discussion that oral health is not at all separate from overall health, and hopefully we have some key practices that we can now incorporate into our daily routines. I'm going to hand it over to Mayappan Uncle to do some concluding remarks now, if he's available. Oh, there he is.
Yeah. Thanks, Lakshmi. Thank you everyone for joining the call today, the webinar, and then I hope it's useful. I found a lot of information, and then thanks Sindhu and then Shiva for putting all this together with the presentation, all the models and everything, and then taking time to answer all the questions in detail as well. And then I thank all my committee members and then who is here as well, who joined in person and then also virtual. So if you have still questions, you can actually send it to HNS committee, or you can reach out to Shiva and Sindhu for to get clarified. And then also, Shiva will be happy if we can get more patients here. He's local, and then and then we have a. I think you somebody asked as well, right? So that's really nice. And then also Shiva brought some goodie bags here. It's really like a dental visit here for us. So whoever virtual probably missing it, but we are going to get each one. And then, yeah, it's really a great session. And then look forward for more in future with the different topics as well from HNH. So, yeah, here we have, yeah, tea, snacks, and water. It's all available. So, from next time, try to come in person, and then we can make it more interactive and then more useful. Yeah. And then, yeah. Yeah. Thanks for Lakshmi, and then thanks to Navanidhi and then Muthu for audio video as well here, and then also the technology committee who is not here, but I already bothered them enough yesterday and day before to get all the things set up and run the show. So thanks everyone who involved in making this happen. Yeah, thank you so much.
Thank you guys.
And we can share our
Yeah, we can
emails.
share the recording.
We'll share the emails and I can send out the slides and stuff. So
Yeah, also we have the recording, so we'll upload it to archie.org and then we'll share the slides as well. Yeah. Thank you.
Thank you guys.